Strictly speaking, a disease like cancer does not exist. A term that describes over 200 different diseases in which normal cells begin to multiply abnormally, forming a rapidly growing tumor and can infect adjacent organs. Despite the fact that the death rate from cancer has been falling for a quarter of a century, cancer remains one of the main causes of death worldwide. In 2018, cancer digestively almost 18 million people. Of these, nearly 5 million cases the disease can be detected at an earlier stage, that is, before you start treatment and make it more effective. We want people to know that many cancers are treatable and even curable, especially if as early as possible to identify the disease and start therapy, emphasizes the chairman of the Union for International Cancer Control, Kerry Adams. For example, if cervical cancer is diagnosed at a late stage, the chances of the patient to live another 5 years does not exceed 15%. However, if the disease is detected in time, this figure rises to 93%. It is therefore important to be screened regularly. Although in Britain, for example, according to the survey, every fourth patient doesn't want to go to the doctor only because afraid to hear the terrible diagnosis. The nidus can be located in any organ and can take different forms. However, there are some symptoms and warning signs, noting that not as soon as possible to consult a doctor. Unusual nodules of tissue, bloating and swelling. We must remember that cancers are often painless, especially at the early stages of the disease. Special attention should be paid to the neck, tests and mammary glands in females and also in armpits. Changes in usual bowel habits. Suddenly it began to constipation, or, conversely, frequent bouts of diarrhea, especially if the chair can be seen traces of blood. Any unexplained weight loss. If you unexpectedly lost a lot of weight in a relatively short period of time, about a couple of months, is cause for concern and a trip to the doctor. Besides cancer, sudden weight loss can signal a serious malfunction of the thyroid gland or development of diabetes. Chronic fatigue and catastrophic lack of energy to do things, despite normal sleep. Usually, if the cause of chronic fatigue in early cancer, the patient manifested other symptoms. Unusual changes in the breast. Concern can be a sudden change in the size or shape of the breast, and changes in sensations when touched, including the skin of the chest or pain. Loss of appetite. If you have permanently lost my sense of hunger and you eat less than usual, it is also an alarming signal, even if you have no other symptoms. The appearance of cancer can be triggered by both genetic predisposition and external factors, including ionizing radiation, chemicals, carcinogens, e.g., asbestos or arsenic, or disease-causing organisms. Avoid smoking and tobacco smoke. Warning, written in large letters on cigarette packs, did not get there just like that. Smoking or chewing tobacco can cause not only lung cancer but also cancer of the larynx, prostate, pancreas, kidney, bladder and other organs. Safe sex and medical procedures. The viruses that can increase the risk of developing certain types of cancer, sexually transmitted diseases, as well as through the blood, for example, when you use shared needles or medical instruments reusable. Vaccinate. For a small fee or even for free vaccinations against hepatitis B, human papillomavirus and other diseases that will also significantly reduce the risk of some types of cancer. A healthy diet and active lifestyle. A balanced diet with lots of vegetables and fruits, good sleep and at least a little regular exercise will help you to boost immunity and avoid many diseases including cancer.